Hey guys, it's Dr. Nate here at Thrive Dental and Orthodontics, and I want to talk to you today about something that I love talking about, and that is why people's teeth are yellow and how we can make those things bright and shiny and pearly and white. So cue up the theme music and we'll be right back to talk to you about the different types of staining and how we can make your teeth beautiful and white. So the question is this: how do we get better, more informed patients and run successful businesses? How can I get the information I've learned from opening multiple dental offices and treating thousands of patients out to you? Those are the questions, and my weekly videos will give you the answers. My name is Dr. Nate, and welcome to the Thrive Dental and Orthodontics channel. All right, guys, so you probably stumbled upon this because you're wondering how you can get your teeth whiter, why your teeth are yellow. So let us talk about it. So there's two main types of stains. There's an intrinsic stain and an extrinsic stain. Those two types of staining are very, very different. So I want to go into those because that will help explain how you're going to make this better, how you're going to get your teeth nice and white and pearly white. So the first one is, let's talk about extrinsic, because that is the easiest one to explain, and that's the one that people probably know the most. And that is when you have stuff on the outer surface of your teeth. So of our teeth, there is this outer surface called enamel, and you probably hear that on the commercials all the time because they're always talking about strengthening enamel with fluoride or with whatever you're trying to strengthen them with. And so that is the outer surface of the teeth. On the inner surface, or in kind of like the middle layer, you have something called dentin. And then it's important to understand the differences because enamel is the outer surface, and in general, it's relatively white unless you have stuff that's going to happen to it, like staining. And we'll talk about that in a second. But in general, the outer surface is enamel, and that is white. The inner surface is dentin, and that is yellow. So think about that. We're going to keep coming back to that in a second. So extrinsic stain, so that's stuff on the outer surface of the teeth, on the enamel. Intrinsic is on the inner surface, and that's in the dentin or in the pulp chamber where all the nerves and blood vessels are. So extrinsic is anything you're eating that can stain your teeth. So I say if it can stain your clothes, it can stain your teeth. So coffees, teas, wines, all that good stuff that we love to eat and drink are gonna probably stain your teeth, okay? So what's gonna happen is it's gonna latch onto the surface of the teeth, and if it's on there for too long, it's gonna kind of weasel its way into the inner surface over time. Probably the worst things you can have are stuff that are acidic and colorful. Like that's the two worst things you can have. And the reason is because if it's acidic, think about it. If the outer surface of the tooth, the enamel is nice and smooth, boom, you have something that can stain, it kind of just glides off, not a big deal. But if it's acidic, that's a whole different story. So say you have the outer surface of the teeth, the acid's gonna erode away at the teeth, and then you have the colorful agent, whatever that is, if it's coffees or teas or wines, and it sticks to the surface of the teeth until maybe you brush it off or drink some water or do something to get it away. So what if you have wine, which I love, red wine, you have that red wine, it sticks on your teeth, and what if you don't even brush your teeth that night, which is kind of like nasty. You would hopefully not do that, but say you don't brush your teeth at night. So you have wine, you're drinking it all night, it's eroding away the surface of the teeth, and then it latches onto the teeth, and you don't brush your teeth that night, it stays on your teeth the whole night. So in the morning, now that pigment is gonna kind of gradually make its way into the teeth, staining your teeth, which is obviously not good. So that is extrinsic stain. That is stuff on the outer surface of the teeth. The good news with that is the easiest thing to take care of, which I will talk to you about in a second. All right, now we have intrinsic stain, and that's on the inner surface of the teeth. And this is less likely. So this probably happens when, if you're young, maybe 6, 7, 8 years old, you go and you're running around on the playground, boom, smash your teeth. That tooth has trauma to it, and maybe initially it might not seem like a big deal, but over time it gets darker and darker and darker. And the reason for that is because the inner surface of the teeth has the blood vessels and these nerves, and it's almost like a bruise for the tooth. So the nerves and blood vessels kind of burst. They send out all these pigment, all the red blood cells that eventually start to shine their way through the teeth. So potentially you may see somebody who has these kind of dark teeth because they hit it. They had trauma on the tooth, the nerve and the blood vessels burst, and now those pigments from the blood have started to seep their way through, and you have these dark, dark teeth. That's one type of extrinsic or intrinsic stain. Another type, or a bunch of different types, are these growth factors. So sometimes what happens is when ladies are pregnant, they may have taken antibiotics. This doesn't happen as much now, but it happened in the past. And there's stuff like tetracycline, and this is like a different type of antibiotic that they were taking while they're pregnant. And as the baby's developing, because we develop our teeth really young, all the way from in the womb to the age of 3 or 4 or 5. And these teeth are developing with these antibiotics. And those antibiotics actually stain the inner portion of the tooth. So that will happen sometimes with antibiotics. There's other developmental issues which people don't have too much of, like dentinogenesis imperfecta or amelogenesis imperfecta. These are different types of diseases that are a little less common, but these are all types of intrinsic stains. Less common, but way, way, way harder to treat. So let's talk about how you're gonna make these better. So if you have intrinsic stains, you don't have too many options. So say you smashed your tooth, you traumatized it, you're probably gonna have to get something called internal bleaching, where they basically kind of put some bleach on the inner surface of the tooth, and very, very likely you're gonna need a crown. And that's just kind of how it is with all these other issues, that it's the inner surface, the dentin and the inner surface of the tooth that's really, really stained. Most likely you're gonna need a crown or veneer or something cosmetic if you want your teeth to be nice and pretty. But that is the minority of the population. The majority of the population has something called extrinsic stains. So let's talk about how we make that better. Number one, prevention. Of course, that's easy to say, but that is the easiest way to prevent your teeth from getting yellow in the first place, because once they're yellow, you have to do these things to make them nice and pretty. So if you're gonna have stuff like wines, coffees, teas, curries, all that fun stuff, you probably should brush your teeth or rinse with water right after you do it. So that's what I do all the time. If I'm having coffee, which I have all the time, or red wines or something of that nature, I will wash with water right after, so you get those stains off your teeth. Because maybe you're having some coffee. No big deal. You rinse it out with water, not the end of the world. So prevention is key. Make sure to get your 6-month checkups where we're cleaning your teeth. Make sure to get an amazing toothbrush, maybe like our Thrive toothbrush, little plug there, or a Sonicare or something along that line, to make sure your teeth are nice and pretty. Don't use a manual toothbrush. Nobody uses manual toothbrushes anymore. Don't use it. Electric is the only way to go. Electric will make your teeth white. Keep that in mind. Electric toothbrush, get one. Very, very small investment to make your life just so much better. Electric toothbrush, get it. Dr. Nate, it's too late. I already have this nasty teeth. I have this staining, this brown staining, this yellow staining, this whatever staining on my teeth. Okay, step number one, make sure they're clean. Make sure you come to the dentist, hygienist, get everything nice, pretty nice and clean. Step number two is you're gonna have to whiten your teeth, and there's a bunch of different ways to whiten them. The 3 probably most popular ways, which I've talked about in other videos, is maybe some sort of white strips, like a Crest white strips, or you're gonna do at-home professional bleaching. And that's when you come into the office, we make you personal trays, and we take this whitening solution and take them home and whiten your teeth. That'll take a couple weeks, but it does a good job. But the most quickest, easiest, most effective way is to come in the office and do something called Zoom whitening. And that is a 1-hour whitening session where you walk in, you get your Zoom, you walk out an hour later, and bing, your teeth are nice and white and pretty. Keep in mind that is only for extrinsic stains. So if your teeth were nice and pretty, nice and white, or maybe they're a little bit yellow now because you've eaten or drank stuff that maybe is not the best for your teeth, that will help you out. And if you come in, we'll be able to tell you, yeah, this whitening is gonna help you, or maybe the whitening might not help you that much. All right, guys, so that's kind of the main difference. You have intrinsic stains, which is the inner portion of your tooth, and basically that's from trauma or developmental issues. And the main way to fix that is crowns, veneers, something aesthetic on your teeth, maybe some internal bleaching. That's probably the main way to fix it. Then you have extrinsic stains, which is the majority of people have. And that is just, you had nice white teeth, or maybe you had yellow teeth initially, but you've actually kind of made them worse by the foods you've eaten, the beverages you've drank, anything that is gonna stain the teeth, and that is extrinsic stains. The good news with the extrinsic, easy peasy to get rid of. Make sure you get that electric toothbrush, make sure you're coming for your cleanings, and then you get your whitening done. And if you do all that stuff, most likely your teeth are gonna be nice and pretty. The last thing I wanna say is that as we get older, unfortunately, our teeth tend to get more yellow. And the reason for that is the enamel surface, the surface that is white, tends to get less and less as we age, because we're gonna break things, we're gonna acid erode away our teeth, and so the inner surface, the dentin of your teeth, starts to show through a little more. So unfortunately, as we get older, our teeth start to get more and more yellow, so that is why prevention is key. Make sure to come into your visits, make sure you keep your teeth super healthy. Hopefully you're not gonna traumatize your teeth. If you're a grinder, you brush, please come in so we can get you a night guard so that you won't kind of tear away at your teeth, because you want to keep that enamel surface, because you know why? Once that enamel is gone, it is gone forever. You do not regrow enamel. Do not ever regrow enamel. So once it is gone, it is gone. All right, guys, there you have it. That is why your teeth may be yellow, the 2 different types, how you can make them better. Unfortunately, as we age, your teeth are gonna get more yellow. So prevention is key. Make sure to come in for your visits. Make sure you keep your teeth beautiful so you can have beautiful white teeth forever, ever. All right, guys, once again, this is Dr. Nate here at Thrive Dental. You know I'm trying to answer all your dental questions, so leave your comments and questions below. Please subscribe. I'm putting out videos every single week. So I will see you guys in the next video.